Hello everyone, today the topic which you guys gonna study is mitral stenosis. The mitral stenosis means the narrowing of the mitral valve. The mitral valve is a valve between the left atrium and the left ventricle. Normally the size of the mitral valve is about 5 centimeters square. So whenever there is a decrease in the size of mitral valve, it is called as mitral stenosis. It is usually asymptomatic, but when the size decreases or it reduces to about 2 centimeters square, the patient will present with a symptom. And in severe mitral stenosis, the size can be reduced up to 1 centimeter square. Now a question arises that what causes the mitral stenosis? Remember that the mitral stenosis is caused by a wide variety of disease. The first one is a rheumatic heart disease. The rheumatic heart disease is the most common cause of mitral valve stenosis. What happens in rheumatic heart disease? When a patient develops our streptococcus pharyngitis, after the resolution of a streptococcus pharyngitis, the patient will develop autoantibody against a mitral valve. Due to the action of the autoantibody, the patient will develop a mitral valve stenosis. The second one is heavy calcification of the mitral valve. Due to the aging process, there will be a wear and tear which will lead to heavy calcification, and the calcification will lead to the narrowing of the mitral valve. So it will lead to a mitral stenosis. The last cause of mitral stenosis is a congenital mitral stenosis, mean a patient will born with a mitral stenosis. It is a very rare form of mitral stenosis, but patients with congenital mitral stenosis do exist. Now let's discuss the pathogenesis of the mitral valve stenosis. As I discussed previously that in mitral stenosis, there will be narrowing of the mitral valve. So there will be obstruction toward the forward flow of blood. So as a result, the blood will start accumulating in left atrium. Due to accumulation of the blood in left atrium, there will be increased left atrial pressure. This will induce two changes. The first one is that the patient will start accumulating blood in pulmonary system, which will lead to pulmonary venous congestion, which will cause breathlessness. The breathlessness is the most common presenting symptom with mitral valve stenosis. The second one is that due to increased left atrial pressure, there will be hypertrophy and the dilation of left atrium. So due to dilation, there will be atrial fibrillation. So the atrial fibrillation will cause palpitation and it will increase risk of thromboembolism due to the slowing or the thrombus formation in left atrial appendage. Apart from these changes, due to obstruction to the forward flow of blood, the patient will also suffer from forward pathology, such as that there will be decreased blood in left ventricle. So there will be low cardiac output. So the patient will suffer from chronic fatigue due to low cardiac output. In short, the patient with mitral stenosis will present with breathlessness, pulmonary edema, hemoptysis and cough due to pulmonary congestion and fatigue due to low cardiac output. Apart from that, the patient will have increased risk of thromboembolism due to atrial fibrillation. After symptoms, now let's discuss the physical sign of mitral stenosis. It is very important because the mitral stenosis are mostly asymptomatic, and if the patient develop a symptom, this is very a severe kind of disease. So on the basis of physical sign, we diagnose a case of mitral stenosis because the patient will have developed the physical sign before or earlier than the symptoms. So the first sign of mitral stenosis is a mitral facies, mean that the patient of the mitral stenosis will have a characteristic face. You guys can see the mitral face in this image. The second one is that the patient will have loud and palpable first heart sound. Why there will be loud and palpable first heart sound? As we guys know that the first heart sound is produced due to the closure of mitral and the tricuspid valve. So in mitral stenosis, the force which closes the mitral valve is increased due to increased pressure in left atrium. So due to this increased pressure, there will be increased pressure gradient between the left atrium and the left ventricle. So due to this increased pressure gradient, there will be loud and palpable first heart sound, mean that the mitral valve will close with greater intensity. Other than loud and palpable first heard sound, the patient of mitral stenosis will also produce murmur due to the turbulent flow of blood across the mitral valve. The murmur of the mitral stenosis is a low-pitch diastolic rumble with opening snap. You guys can hear the murmur of mitral stenosis now. Other than murmur, the patient of the mitral stenosis can also present with crepitation, pulmonary edema, and pleural effusion due to left heart failure. And apart from that, the patient can also present with right ventricular heave and loud P2 due to pulmonary hypertension. So it was all about the sign and symptom of mitral stenosis. Now switch our gaze toward the investigation to be done in patient with mitral stenosis. The first and the most initial investigation that should be done in a patient with mitral stenosis is echocardiogram. The transthoracic echocardiogram is the initial test of choice for the diagnosis of mitral stenosis. On echo, the patient will have the echocardiogram will show thickened immobile cusp with reduced valve area and the enlarged left atrium. Apart from that, the echocardiogram will also show the reduced rate of diastolic filling of left ventricle. After this, we can also perform a Doppler echocardiography. The Doppler echocardiography will give us a detail about the pressure gradient across the mitral valve, the pressure in pulmonary artery, and the left ventricular function. The Doppler echocardiography is the investigation of choice for the evaluation of a patient who is suspected of having a mitral stenosis. Apart from this transthoracic echocardiography and the Doppler echocardiography, we can also consider a cardiac catheterization if we are planning for valvuloplasty or surgery. Apart from this, we can also do ECG and the chest X-ray. These two are not important in investigation, but it should be done if we are expecting some complication associated with mitral stenosis. ECG finding in mitral stenosis will be a right ventricular hypertrophy, mean that there will be a tall R wave in lead V1 and V3. Apart from that, the patient will also have a bifid P wave, also called as a P mitral, and the patient can also have a atrial fibrillation. But all of these changes are associated with complication of mitral stenosis. Last one is the chest X-ray. It is not as like ECG, it is not very important. It will just show the complication of mitral stenosis, and on chest X-ray we can see enlarged left atrium, and there will be a sign of pulmonary venous congestion due to heart failure. It was all about the investigation that we should perform in patients who are suspected to having mitral stenosis. Now let's discuss the management option for mitral stenosis. A patient of the mitral stenosis present with mild symptom, then we can treat a patient with medical therapy. The medical therapy for mitral stenosis include an anticoagulation which will reduce the risk of systemic embolism. Along with that, we can reduce a ventricular rate with beta blocker, digoxin, and the rate limiting calcium channel blocker. Other than these, to treat the pulmonary congestion, we can use the diuretics. The diuretics will decrease the pulmonary congestion. Last thing is that we can also advise antibiotic for prophylaxis against infective endocarditis. But this is no longer routinely recommended. It was all about the medical treatment of mitral stenosis. So when a medical treatment fails and a patient have an increased risk of pulmonary hypertension, we can also perform some interventional and surgical procedure such as a mitral balloon valvuloplasty and valve replacement. Balloon valvuloplasty is a treatment of choice, but it requires certain criteria to meet. If this criteria is met, then we can perform a balloon valvuloplasty, and it is a treatment of choice for mitral stenosis. Criteria for mitral valvuloplasty mean that if this criteria is met, then we can perform a mitral valvuloplasty. It includes that if a patient should have a significant symptom, there should be an isolated mitral stenosis, there should be no mitral regurgitation, and there will be mobile, non-calcified valve, and apart from that, the patient should have a left atrium should be free of a thrombus. If this criteria is met, then we can perform a mitral valvuloplasty, and it is a treatment of choice for mitral stenosis. Apart from this, the open mitral valvotomy is an acceptable alternative for balloon valvuloplasty. After balloon valvuloplasty and the open valvotomy, we should follow up a patient for at least 1 to 2 years because there's an increased risk of a restenosis. So patient should be under close observation for 1 to 2 years. Now let's discuss briefly the mitral valvuloplasty, that how we will perform mitral valvuloplasty. In mitral valvuloplasty, we introduce a guide wire through femoral vein or the inferior vena cava. It will reach the right atrium. In right atrium, we puncture the interatrial septum, providing an access to the left atrium and the mitral valve. Once we reaches the mitral valve, then we will introduce a balloon catheter. The balloon catheter will advance over the guide wire across the mitral valve, and then the balloon will dilate. When the balloon will dilate, it will reduce the degree of a stenosis. So in this way, we treat the stenosis in mitral stenosis with the help of mitral valvuloplasty. It was all about the mitral stenosis. If there is still any question, you guys can ask, and stay tuned for more update.